You may be surprised to learn that, according to research, about 60% of adults do not get enough magnesium from their diet. In other words, every second person lives with a magnesium deficiency without even realizing it. Mild magnesium deficiency often develops silently, and when symptoms do appear, they are usually nonspecific and easily mistaken for stress, fatigue, or aging. That is exactly why it often goes unnoticed. And if things were simple, a blood test would show everything. But here's the catch. Only about 1% of all the magnesium in the body is found in the bloodstream. So a standard blood test cannot reliably determine whether you have enough magnesium, which means you need to be able to recognize the signals your body sends. I'm Dr. Helena. Today we'll talk about the signs that may indicate magnesium deficiency and why you should not ignore them. 1. Muscle cramps and spasms. Let's start with the most obvious sign. When the body has enough magnesium, it keeps nerve cells calm and stable. It essentially dampens excessive excitability by preventing calcium from flooding into the cells uncontrollably. When magnesium becomes too low, calcium accumulates inside muscle fibers, and the muscles contract too actively. As a result, you may experience cramps, twitching, spasms, tingling, or numbness. Magnesium is also involved in producing energy, ATP, without which no muscle can work properly. So when magnesium is low, the muscles fatigue more quickly, even with minimal effort. Research shows that magnesium reduces neuromuscular excitability and helps prevent cramps. However, it's important to understand that muscle cramps are not caused by magnesium deficiency alone. Potassium deficiency can also trigger them, often even more strongly. Interestingly, magnesium deficiency frequently coexists with hypokalemia, low potassium levels, and worsens it, making it more resistant to potassium treatment. Therefore, if muscle cramps occur, it is worth taking both magnesium and potassium. There are many other potential causes of muscle cramps as well: dehydration, prolonged sitting, stress, hypothyroidism, certain medications including statins, or excessive physical exertion. Among older adults, frequent muscle cramps are often related to age-related muscle loss. So magnesium supplements don't always fully resolve the issue. 2. Chronic fatigue. If you frequently feel weak, sleepy, or generally drained, this may also be a sign of magnesium deficiency. Magnesium is essential for ATP production, the body's universal energy molecule. When magnesium is low, cells struggle to generate enough energy, and even simple tasks may leave you exhausted. 3. Sleep disturbances. Magnesium activates the parasympathetic nervous system, the rest and restore system. When magnesium is insufficient, falling asleep becomes harder, sleep becomes lighter, and melatonin levels drop. Sometimes people don't understand why they never feel rested, even if they sleep 8 hours. 4. Craving chocolate. That irresistible "I need chocolate right now" feeling. Cocoa beans are one of the richest natural sources of magnesium and also stimulate dopamine, the pleasure neurotransmitter. What matters is the type of chocolate you crave. If you crave milk chocolate, you may simply want quick carbohydrates. But if you strongly crave dark, bitter chocolate, this may be your body signaling low magnesium, not just a sweet tooth. 5. Cardiovascular symptoms. A key manifestation of magnesium deficiency appears in the cardiovascular system. People with low magnesium may feel heart rhythm disturbances. Magnesium is essential for maintaining a stable heartbeat. It regulates the balance of potassium and calcium inside cardiac cells and stabilizes electrical activity. When magnesium is insufficient, calcium enters cells uncontrollably, disrupting electrical stability and causing palpitations, skipped beats, extrasystoles, or rapid heartbeat. Research confirms the critical role of magnesium in preventing and managing arrhythmias. Studies show that low magnesium levels are associated with a 50% higher risk of atrial fibrillation, one of the most common and dangerous arrhythmias, increasing the risk of stroke and heart failure. Meta-analyses demonstrate that magnesium supplementation can reduce the risk of various arrhythmias by up to 68%. It literally helps the heart stay in rhythm. 6. High blood pressure. Another common sign of magnesium deficiency is hypertension. When magnesium is low, calcium accumulates inside cells, causing them to overcontract. As a result, blood vessels constrict and blood pressure rises. Magnesium helps relax vascular smooth muscle, improves blood flow, and lowers peripheral resistance, bringing blood pressure closer to normal. Its deficiency, on the other hand, contributes to hypertension and increases cardiovascular strain. Research shows that magnesium supplementation can lower systolic blood pressure by 3 to 4 millimeters of mercury and diastolic pressure by 2 to 3 millimeters of mercury on average. Magnesium helps stabilize blood pressure gently, but it is not the primary driver of hypertension. Beyond its effects on rhythm and blood pressure, magnesium improves endothelial function and has anti-inflammatory effects, strengthening the cardiovascular system as a whole. 7. Migraines and headaches. Magnesium influences several neurochemical pathways involved in migraine physiology. Although the exact mechanism of migraines remains unclear, the condition is linked to increased neuronal excitability, inflammatory signaling, and impaired neurotransmission. Magnesium regulates calcium entry into neurons and reduces the release of pro-inflammatory pain-inducing molecules like substance P and glutamate. It also participates in serotonin synthesis, crucial for vascular tone and pain sensitivity. People with low magnesium may have a 7 to 35-fold higher risk of migraine. 8. Anxiety and depression. People with low magnesium levels have a 34% higher risk of depression and often experience irritability or anxiety. Why? Magnesium is essential for healthy brain function and emotional balance. When magnesium is low, nerve cells become overly excitable. This occurs because magnesium regulates NMDA receptors, key structures involved in excitatory neurotransmission. With insufficient magnesium, these receptors become overactive, overstimulating the nervous system. This leads to anxiety, irritability, inner tension, and mood swings. Over time, this chronic overstimulation can contribute to depression. Magnesium is also required for the production of serotonin and GABA, neurotransmitters responsible for calmness, relaxation, and stable mood. When magnesium is lacking, their synthesis is impaired, worsening anxiety and reducing stress resilience. When magnesium levels normalize, many people experience reduced anxiety and more stable mood. 9. Seizure states and epilepsy. Scientists note that magnesium deficiency can increase susceptibility to seizures. Magnesium helps stabilize neuronal electrical activity, lowering the risk of epileptic episodes. 10. Metabolic disturbances. Modern research shows that low magnesium is strongly linked to insulin resistance and, consequently, type 2 diabetes. People who get enough magnesium have a 22% lower risk of developing diabetes compared to those who don't. In people with diabetes, low magnesium is associated with complications such as impaired vision, kidney dysfunction, and delayed wound healing. 11. Bone fragility. Almost half of the body's magnesium is stored in the bones. It activates vitamin D and helps keep calcium in bone tissue. When magnesium is low, calcium shifts into soft tissues instead, and bones lose strength. Studies confirm that magnesium deficiency contributes to osteoporosis, accelerating bone loss and reducing bone density. And when magnesium levels are adequate, bones are stronger and fracture risk decreases significantly. Magnesium is involved in virtually everything, from sleep and mood to heart function and bone integrity. And although blood tests don't always reflect its true status, the body sends clear signals. You simply need to notice them. Take care of yourself, and remember, sometimes a tiny nutrient can influence your well-being far more than you think.